Good day, Miss. This is Ezekiel Haney Arong, and I am going to discuss today about nebulization theory. So first, what is a nebulizer? A nebulizer is attached to a flow of air or oxygen, converts a solution of a drug into an aerosol for therapeutic inhalation. So first and foremost, before going to the procedure, it is always important to wash the hands with soap and water. This is to prevent and avoid the spread of microorganisms. So first procedure is to check the medication order against the original physician orders according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps us to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Second procedure is to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Check the patient's chart for allergies. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Third is to place the medication on a tray. Organization facilitates error-free administration and saves time. Fourth is to transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangements of medication. After transferring, it is always important to identify the patient by checking the name and identification on the patient's identification band on his or her wrist. Or you can ask the patient to state his or her name if he or she is conscious. Identifying the patient ensures the right patient receives the medication and helps to prevent errors. Next is to explain the procedure to the patient. This is to gain cooperation and to lessen anxiety of the patient. Next is to fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given to the patient. After filling the nebulizer cup with the medication, turn on the compressor to ensure the efficient vaporization of the medication. Next is to observe the fine spray from the nebulizer to check that the equipment is working. Next is to encourage the patient to breathe the nebulized vapor through the mouthpiece or mask. So we have here an example for the adults and for the kids. Breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. After that, remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mouthpiece or vent holes in the mask. Lack of mist ensures that the client has inhaled all or the entire dose. After that, encourage the patient to expectorate, as the medication may help to loosen the bronchial secretions. Or you can also apply the huff-cuff technique. So first is to sit up straight or sit upright, breathe 3 times, bend the arms, raise the elbows, and hold breath. And lastly, exhale forcefully. So next, step 13 is to ensure that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured in his or her position. After ensuring the patient is safe and secure, wash and dry the nebulizer, tubing and mask or mouthpiece. We have here the tubing, the mouthpiece or mask with warm soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. After the washing and drying process, retain the equipment in a polythene bag. For the patient's next administration, to prevent infection, the equipment should be changed every 24 hours. And the last step is to document the nursing practice appropriately, monitor adverse effects, and report any abnormal findings immediately to ensure safe practice and enable prompt, appropriate medical and nursing interventions to be initiated. And lastly, we have evaluation. We have four. First is to increase expectoration of secretions occurred. Second, patient experienced less labored breathing. Third, sounds improved. Fourth or last is the aerosol medications administered into deep air passages and ventilation improved. That is all. Thank you.